All right, welcome back to the podcast. On this episode, we have a very special guest, Katie Webb. Katie, how you doing today, ma'am?
Hey, I'm doing great. How are you?
I'm doing awesome. I had great coffee this morning, great breakfast, and I'm fired up to talk to you today.
Great. Me too.
Awesome. Katie, for those of us that don't know you, can you tell us a little bit about yourself and your practice?
Yeah, definitely. So I'm from Pasadena, California, and I'm an associate marriage and family therapist. I have training working with families, couples, and then also individuals. So I see all three of those groups.
Got it. Of those groups that you work with, what are some of the presenting concerns that they have?
Yeah. So with families, you can see there's such a big variety, right? Sometimes families will come in because there's a member of the family that's really struggling with something, and the rest of the family unit is really trying to cope and figure out how to support that person in the best way. Sometimes in families, you'll get just a lot of different dynamics. Sometimes in families, it's just really hard to coexist in like a positive way, right? Because everyone has so many different needs. So sometimes I'll get families who are just having a lot of different dynamics and need to sort of figure out their roles and patterns and deal with some of those things so that they can be happier and just function better. And, sometimes in families, you'll get children with parents that are dealing with co-parenting situations or different marriage setups, and that takes a little bit more work to structure that and figure that out. So there's all sorts of different family dynamics that bring families in. For individuals, I think the most common reason people come to therapy would be for depression or anxiety, but there's just so many different reasons why somebody might come. um, those are the top two, but I think relationship struggles is a big one as well. And then I also have a focus of working with people who are companions or spouses with someone who works in the medical field, like a medical professional, because that's a very demanding, high stress job. So I focus on supporting those people as well, kind of navigating that journey and all the impacts on your family and on yourself. Let's see, the last one I didn't talk about is couples. So couples typically come in because they're having some sort of rupture or issue with their relationship that they're trying to work through. Sometimes right at the beginning when they come in, that might be like a more intense issue that they're really trying to figure out, big challenge they want to get through, or possibly figuring out how to end the relationship. So there's all sorts of different reasons couples will come in. And then, down the line, once couples have been in therapy for a while, they might come back just for some maintenance to try to check in on how things are going. Yeah.
Wow, yeah, it really sounds like you are able to help a lot of people out there that are in need, and I think that's really awesome. Katie, how do you ensure that a client is a good fit for you and that you are a good fit for the client?
Yeah, that's a really good question. I think it's super important in therapy to feel like you have a good match with your therapist, to feel like you click and you feel comfortable and can be honest with your therapist, and the therapist can also be honest back, right? So that's also referred to as the therapeutic alliance. You want to have a really strong alliance with your client. So a way to figure this out just right off the bat is to give a quick call just before you've even started your first session. And I like to do this on video. It's usually about 10 or 15 minutes on Zoom, just to meet face to face and just chat about what's bringing the person to therapy or the people to therapy. And then I can tell them a little bit about myself, and then we can decide if it's a good match to continue. And then, really, in the first or second session, usually by then you kind of know. But if there's something that comes up in those sessions where it just doesn't feel quite right, or perhaps like maybe I don't have the exact experience in the area that person needs, then, I have no problem telling them, I think it would really benefit you to see someone who specializes in XYZ, and then connect them with that person.
Yeah, that's awesome. So there's a lot of different like modalities out there, right? We got EMDR, CBT, Gottman, all of these great specialties. Um, which one do you use in the work that you do?
Oh, yeah, that's a great question. So, with families, I practice a lot of family systems. And so, really, that's taking a look at the family as a whole and how it's functioning. So, we like to look at this as the dynamics and how they interplay, right? Um, for example, this is just a really common example to explain it. You could look at a troubled teen, right? And that teen is really struggling, and it's causing the parents to have to put in a lot of effort and work to work with this teen to help them. And the parents really come together and plan and spend a lot of time on this, right? And so you could actually look at that as a negative thing, right? It's a negative thing for the parents to have to devote so much time. It's really getting in the way of their work ability to work and perform the necessary tasks in their daily life. And so they come to therapy and they're like, this is a problem for us. So looking at it from like a family systems perspective, you might want to think about that, right? It's a problem, so they need to address that, but also the underlying dynamics there. So perhaps this issue is actually bringing the parents together in a way that's really beneficial for their relationship, because it's really causing them to spend a lot of time together and work together, right? So you might look at the situation and think, okay, well, if we solve this problem, what might happen to the family in these other ways, right? And so it's not that you don't want to solve the problem, but you're just trying to look at all the different dynamics in a family and how they all come together and interplay. So yeah, that's one thing I use with families. With individuals, I tend to use a couple different methods, all postmodern, right? So I practice from the stance that the person in therapy knows the most about their life and about the challenges they have, and they personally have the skills within them to solve that, right? So that might sound crazy, right? Because people are coming to therapy so that they can have help to solve these issues, right? But I view my job as a very thoughtful listener, a very good listener, and also ready to ask the right questions that are thought provoking and can help bring new perspectives, bring new perspectives that are in line with the goals that the person has. Um, and it doesn't mean I'm never going to offer my perspective, but when I do, I will make sure that it's something that supports and aligns with the journey and the goals that person has. So I'm going to look at everything from the client's worldview, right? Instead of like my own experiences. It's impossible to completely separate your experiences, right, as a therapist, but the idea is that you're trying to really understand from the client's perspective. So I refer to this as collaborative therapy, right? And it's working hand in hand with your client and really trying to understand what works for them, and then navigate how to create more of that, how to bring more of those solutions into their life, and how they think they might be able to do it. um, I think from narrative therapy, there's something called externalization, and that's something that I think is very powerful as well. It's the idea that sometimes the problems or challenges in our lives are can be viewed as separate from us, right? And so this helps really with like a lot of thinking around shame, around, feelings like guilt, which is not necessarily a bad thing. Guilt isn't always a bad thing, but it's also not the most motivating emotion, right? So if you can take some of these things and externalize them and separate them from the person, it can actually allow people to move on from some of the things that they've been stuck in.
I really do have a appreciation for narrative therapy and externalization, and that's something I actually really like using in my own couples work. When I do couples work, is I'll tell both of them like, neither of you are the problem. You're not, and I'll look at each one and I'll say, you're not the problem. And I'll look at the husband, I'll look at the wife, I'm like, you're not the problem. And I'll look back at the husband, I'll repeat it, like, you're not the problem. Hear me, and you are not the problem. And I've had couples in session when they hear that they are not the problem, just break down and start crying because they've been living with this label of like, I'm the bad person, or you know what I mean? The shame and guilt and all these things become a part of their identity. And as soon as we can externalize that, we can really start the therapeutic work. So I really do commend you for using that with your clients. All right, Katie, I'd like to ask, how would you describe your style? Like, some therapists are a little more directive, like they just kind of say how it is, like, this is what you need to do. A lot of therapists are a little bit more laid back. Some involve humor. Some do a lot of like skills training, psychoeducation. How would you describe your style in your practice?
Oh yeah, that's so I feel like for me, psychoeducation and skills, it's really important, especially if you're trying to address like a short-term need. So if somebody comes in and they have something that's really urgent that they really need to get a handle on, I might work with them on some like short-term goals, and talk about psychoeducation and also skills work with that. I think sometimes for some of the deeper work that needs to happen, I would not describe myself as a super direct therapist. I think my process is more meeting the person where they are and trying to elicit them to have their own realization and their own verbalization. Now, there are exceptions. Sometimes the therapist needs to verbalize something and just bring it into the room to be talked about. But I think maybe this comes from personal experience of how I learn, but it's like, for a kid, for example, for an adolescent, when their parent tells them something, they might not, it doesn't really sink in. I think the best learning comes from within. And in therapy, I think I employ that perspective. Like I'll try to lead somebody somewhere, but I'm not going to usually directly tell them, here's what you need to think, here's what you need to do. I would hope that that could come from them.
Yeah, it sounds like you kind of pave the road for their journey, and they're walking the road. You're just paving it and making it easier in a way for them to go on that journey. Yeah, that's really cool. So what happens, Katie, if there's a client a few sessions in, they decide to partner with you and they've done some work, and then they're kind of like, I'm not really feeling it. Like I'm just not seeing any progress. How do you, one, get that feedback from the client? And then what do you do when you do receive feedback like that, when they're not really experiencing any progress?
Oh yeah, definitely. So I think it's helpful to try to use some sort of measurement when you're working with clients. This doesn't always happen. Sometimes you'll have sessions where there just wasn't time for it, or maybe it wasn't appropriate that session, but it's good to get some sort of feedback. So if somebody comes in and they have a lot of anxiety or they're feeling very depressed, it's helpful just to know, like, where are you on a scale of 1 to 10? Or, also you can give them a test, right, to administer for them to fill that out, and you can score it and do it that way. But sometimes it's helpful just to get them to verbalize, like, where are you on a scale of 1 to 10 with your depression and your anxiety? How are you feeling? Like, how are you coping? How are you coping day to day? And that can be just sort of your baseline measurement. Coming into the next session, you can ask again, and you can kind of track, where they are. um, and yeah, if they're not seeing improvement and things are not going well, if sometimes people do need a higher level of care, right? So if someone's in a crisis or something like that and it's not getting better, sometimes that's when it's like, okay, let's think about like how else you can get support with this. Maybe you might see a psychiatrist. Maybe medication might be helpful for you. Maybe you can explore that with the psychiatrist and continue therapy, right? Because usually both those things are done in tandem. Um, if it's a specific issue and they don't feel like they're getting benefit, I think it's an ethical responsibility as a therapist to make sure that it's really a good fit. And if it's not, to be able to find a referral for that person, that maybe has experience with the specific issue that they have, right? So ethically, you don't want to keep doing therapy for too long when it's not helping, right? And so maybe there's a change that you can make in the approach that you're using with that person. And if it does work and if they feel better and they like it, that's wonderful. That's good. And you can move on with that. But if it's not, that's when you would assess with them, hey, it doesn't seem like you're making progress. And I want to work with you to figure out what method we can go on to figure that out.
Yeah, absolutely. And I really appreciate that you expressed exactly that. And that is that, if it's not working, your style or the modality or the approach, that it is an ethical responsibility that we do, right? And we try to keep the client's best interests in mind. And as much as we like to keep the clients, right? At the end of the day, their best interest is what matters most. And so I really appreciate you saying that. On the flip side, what does progress look like for a client that decides to work with you?
Yeah, that's a great question. I think for everybody that looks so different, right? If you get someone who's extremely anxious and having a hard time leaving their house and doing the normal day to day things, progress for them might be leaving their house that day, right? Um, and I think when you're trying to measure progress, it's really important that you have goals with your client. So a lot of times with clients, I like to start off with some short-term goals, which you might be working on week over week with them, and check in the next session. Were you able to do some of these goals that we set last week? These daily goals, right? And then the long-term goals are those deeper goals that you really have to work on together, and you really have to dig deeper into maybe what's in the way of achieving those. But I think if you have those goals, then you can measure the short-term progress and then also the long-term progress by assessing, are you meeting those goals? And sometimes if people aren't meeting their goals, they might actually have changed their goals. So that happens too, right? Because you change your perspective and your mind might change. So just because you haven't met a certain goal doesn't necessarily mean you aren't making progress. But you need to think about if you're not meeting your goals and you want to change them, changing them so you can measure that better.
Yeah, yeah, that's great. You know, Katie, as we both know as clinicians, progress in therapy isn't linear, right? Like I'll often have clients that are like, how long is it going to take? 8 weeks, 12 weeks? Like what, and it's hard to answer, right? And so um, I'd like to ask, how do you prepare your clients for the inevitability that progress may look like one step forward and two steps back?
Oh, yeah. Yeah, that's great. That's really important actually, because so something in the informed consent that I use, which my supervisor created, my supervisor is Carolyn Saltz, and she's the one who has been giving me some professional feedback and supervision. And in her consent form, which I also use, it mentions that the client needs to know that things may actually get a lot worse and feel a lot worse before they start feeling better. So I think that's something that I try to remind clients of. It's hard to be told that when you're starting therapy, but it's also helpful for me to be honest that I sometimes with my clients will use the example that it's sort of like when you want to clean out your house and you take everything out of all your drawers and the closet and it looks really messy and you get really upset and stressed out because your space is so chaotic. But then it's the process of like throwing away the things you don't need and reorganizing, and you start to feel better. And at the end of it, the goal is that you feel even better and your house is more clean, right? And our brains are so much more complex than a house, but just that analogy kind of helps people wrap their heads around it.
Yeah, that's a wonderful analogy, I think. Katie, how do you know when it's time for your client to either graduate or just kind of terminate therapy?
Oh, yeah. So, and this is important too ethically, right? Because we don't want to continue therapy forever if there's not a real tangible benefit for the client. And so I think if your client has met all of their goals and they don't have anything else that they're bringing to you, they're coming to therapy and they're saying, like, things are going really well. I'm feeling really good about everything I came to work on. That's when you might bring it up. Okay, let's talk about an end game plan for therapy. Maybe a few more sessions to tie anything up, and then a plan for when, if things start if you start needing to talk about things or things start getting difficult again in certain areas, when would you come back, right? So the person doesn't feel like they're cut off, that it's complete and over and that they can't ever come back for help, but that they feel like immediately it's ending and they have the tools and the plan to move forward.
Got it. So it sounds like they can terminate therapy, but if they need more support in the future, they can always reach out to you.
Of course, yeah.
Yeah, awesome. Katie, I'd like to switch gears a little bit, if I may, and ask about you. Is that okay?
That's great. Sure.
So what motivated you to be a therapist in the first place?
That's a great question. So, initially, I went to college and I wanted to be a photographer. And my dad was like, yeah, that's a really hard career to make money in. I don't think you should do that. I was like, okay, Dad, maybe you're wise about this. I shouldn't do that. So I went into communications and I studied advertising, and it was really fun. I loved it. I had a career in that, digital advertising. Really enjoyed it, actually. I made a bunch of videos about dogs and babies and just fun stuff, right? It was a lot of work, really hard work, but I liked it. And when I was a teenager, so going back in time, when I was a teenager, my best friend's mom was a psychotherapist. She was actually a marriage and family therapist, right? And she would come home and, I would ask her, what's it like to be a therapist? And everything she would say was so interesting to me because even from a young age, I'm just so interested in people and how they work and how their brains work and their relationships. It's like super interesting to me. So I would always talk to her about her job, and she was great telling me things. So I always had in the back of my mind, it'd be so interesting and such a great career for me to be a therapist. And I never pursued it, had this other career in advertising. And then, I had some kids and was like, I think I'm ready to do a job that's a little bit more rewarding. Advertising is great, but I don't know, maybe it was having kids that made me kind of softened my heart and my emotions and made me realize, like, oh, life isn't all that long. I'm already a parent. I've got kids. I've already passed through these phases of my life. And I think I want to do something professionally that feels more rewarding, and like maybe I'm actually changing people or helping people change in a way that I wasn't doing when I was working in advertising.
Yeah, wow. What do you enjoy the most about the work that you do?
Oh, mm, that's a really good question. I I love I love working with people. That's my favorite thing. And so the fact that for my job I get to talk to someone and be there with them is just the best. I think the moment that's the most rewarding is seeing people have like an aha moment or an epiphany in a session, sort of for them to be able to, because I'm not doing the work, they're doing the work. So to be with someone who's doing that deep work and to be so committed and earnest about that work and to be able to witness that is really cool.
Yeah, yeah. Oh, yeah, I agree. It's definitely a privilege to be there with the client as they, give us access to to what's going on in the personal world. Um, Katie, what's on the horizon for your practice?
Yeah, that's a great question. So I mentioned earlier that have a focus of working with those people who are in families or partnerships with someone who's working in the medical field or professional field, right? So I've actually put together a group therapy session that meets weekly. So I'm working on getting that going because I realize that in that space, there's just a lot of there's men, but there's also a lot of women who need support. It can be a very isolating thing to be with someone who's in medical training or working as a doctor. They can be gone a lot, just not home. And so a lot of times the spouse ends up picking up a lot of that slack. And it can be really hard on like your identity and just being able to make space for yourself. And I've noticed just in that community, there's a lot of men and women who need that support and really turn to each other to get that support and sort of knowing that other people are going through a similar thing and figuring out how they got through. Because, um, when you are in a family where someone's working such a demanding job, a lot of times that other partner just is sort of pitching in ways that can be really hard, really challenging. And yeah, it's really interesting to see like the creative ideas that they have to get through some of these years, and just for people to be able to share those with each other, I think is really empowering. So I'm working on that, and definitely continuing my work with couples and families and individuals at the same time. Yeah.
Wow, that's wonderful. So that group, just for my clarity, is for spouses of people who are in the medical profession. Is that got it? Okay, great. Yeah, that's really wonderful because my significant other is a ICU nurse, and I'll tell you that she comes home and just not only drained because she's on her feet all day and working hard, right? But just seeing death every
Yeah.
day, every day, every day, and it's taken a toll on her emotionally, and physically. And she was young and eager when she started. She's like, "I'm gonna make a difference and help these people out." And a few weeks later, when she starts seeing her patients pass, just for whatever reason, it really does take a toll, and it really can impact. I can imagine how it impacts a relationship So I really appreciate you putting that together. I know there's a big need in the community when it comes to that topic. Um, all right, Katie. So somebody who's hearing this and they're like, I like Katie. I like what she's saying. I like her style, and everything that they're hearing resonates with them. How can they reach out to you?
Oh yeah. So I do have a website. It's kwebbtherapy.com. So kweb. Oh, you see my name, so it's on the screen. kwebbtherapy.com. You can also look me up on Psychology Today. I'm there as well. There's a contact form on my website. You can fill that out. Send me an email. Give me a phone call. We can talk.
Awesome. Katie, this has been a real pleasure. I appreciate you taking the time to come on the show with us today, and maybe we can do it again in the future. How does that sound?
That would be great. Thank you so much, Rich. I appreciate it.
All right, everybody. Thanks for joining. Signing out.